Well, the nurses at Kapiolani Medical Center for Women and Children, they announced today that they are going to be going on strike.
And it's set to begin on Sunday, January 21st, and will last for a week if both sides don't come to an agreement before then. There are more than 600 nurses at Kapiolani Medical Center, and they voted last week to authorize a strike. Their contract ended in November, and negotiations for a new contract have been going on for the past 4 months.
Kapiolani Medical Center is the only maternity, newborn, and pediatric specialty hospital in the state. So what could this mean for patients, and what are the nurses fighting for? Rona Navales went to find out the answers and has reaction from both sides.
All quiet now in front of Kapiolani Medical Center for Women and Children. But come January 21st, the same area might be filled with nurses on strike.
So I've been a nurse since 1993, and for me, it's the first time that be involved in the strike. We've done a strike vote 2 years ago, but for this, it's to give a strike notice that we're doing it. It's new for us.
After nearly 4 months of negotiations, the union's decision is deeply disappointing. The union refused our offer on several occasions, including today, to bring in a federal mediator to assist in negotiations, and has yet to give the last, best, and final to our nurses to vote on.
The union held an informational picket last month. Wednesday was the first day back at the bargaining table since the nurses overwhelmingly authorized a strike last Friday, and they're set to go back to the table on Thursday.
So we've always talked about it. It is the nurse-patient staff ratios, and we want to make sure that, hey, this is enough nurses that we have to take care of the patients that are at the hospital. The problem is over the last 3 years, we haven't been hitting it, and nurses have been working short for a long, extended period of time.
Patients are not numbers. Ratios are numbers, and there's a distinction between that. This is why we are committed to our staffing guidelines. This is the flexibility that we need here in the medical center because of the patients we care for. We need the ability that when a patient needs care immediately, that we need to be able to change course and bring the nurses in that we need to provide that care.
Kapiolani Medical Center delivers more than 6,000 babies a year and has numerous specialty services for babies, kids, and women.
It's going to be hard, especially not being available for the patients, because that is the key reason why we're deciding, okay, we're going to take a stance, is because there are times that we barely see the patients or the families. We're just going to their room to check them out. So we just want to make sure we have enough time to take care of them.
The hospital's message for patients concerned about a strike?
We are still providing excellent care. We will continue to provide excellent care. And we have a temporary workforce that is well trained to provide the same quality of care that our nurses provide. They have made a choice not to provide care during a period of a strike. We, as the medical center, are accountable to this community. We are the resource for Hawaii and the Pacific Basin. We will not falter from that. We've made a commitment to our community, and we've been entrusted with their care. Everyone that's been here yesterday that can come today or will be here tomorrow will get the same quality of care that they've always received.
Again, both sides are meeting at the bargaining table Thursday, and if they don't come to an agreement, nurses are scheduled to strike January 21st. Rona Navales, Island News.